Every year, approximately 30 million people participate in sports, and every year, approximately 3.5 million people suffer sports injuries. 1 out of every 3 children will need medical attention for a sports-related injury at some point during their sports participation. That's why sports medicine has become such an important part of what we do in orthopedic surgery. One of the things that's a bit disturbing is that we're seeing overuse injuries. And in the past, injuries in children were typically more traumatic injuries, more freak accidents that occur with collisions. But now what we're seeing is kids are starting in on sports at a younger age, and they're really being pushed in their sport throughout the year. And they're not really getting a chance to rest and recover. One of the things I try to emphasize to my kids is to cross-train during the season. What cross-training is participating in one sport and then in the next season participate in another sport. One of the most important things that kids can do and parents can do to keep their kids safe is to make sure that they're properly equipped, whether it's a helmet, a mouth guard, eyewear, padding. They should always be properly equipped for their sport. And the other thing that's important is to also make sure that they're playing on proper fields, to make sure that there aren't divots and that the field is well maintained. Some of the signs and symptoms that people need to look for when they have injury are swelling, consistent pain, as well as catching and locking symptoms. If those symptoms persist more than 3 to 4 days, then you should certainly come in and be seen by a specialist. And typically we can get patients back to sport. It depends on the injury that they have. Severe injuries which require surgical procedures may take up as long as 9 months for people to recover from. But overuse injuries, if you rest and if you give your body time to recover, you may be back to sport in a week or 2.